بسم الله الحمد لله والصلاة والسلام على نبينا محمد وعلى آله وصحبه وسلم. Inshallah, today our lecture regarding responding to symptom in pharmacy practice, GIT symptoms. Today, inshallah, we will discuss the heartburn. Symptoms of heartburn are caused when there is reflux of the gastric contents, particularly acid, into the esophagus, which irritate the sensitive mucosal surface, leading to esophagitis, inflammation in the esophagus. Patients will often describe the symptoms of heartburn, typically a burning discomfort pain that felt in the stomach passing upward behind the breastbone. By careful questioning, the pharmacist can distinguish conditions that are potentially more serious or the symptoms that arise from this heart pain. This is pain caused by the reflux of this gastric content back to the esophagus, leading to the esophagitis, leading to a heart pain sensation. What you need to know as the community pharmacist to respond well to a patient or a customer that complain from the symptoms of heart pain. You should know the age, is it adult or a child, and the symptoms, the heart pain, is there any difficulty in swallowing, flatulence, and other associated symptoms. If the patient or the lady is pregnant, because pregnancy is one of the precipitating factor or one of the factors that usually accompanied by heart pain. Precipitating factors, relieving factors, and weight of the patient, because of overweight, also one of the leading factor or precipitating factor of the heart pain. Smoking habit, but this is also one of the factors that can contribute to the heart pain, and the eating pattern of the patient, the medications that used by the patient. Also, you should know the medicines that tried already to relieve the symptoms before, and other medicines that are being taken by the patient. You should know the age, because the symptoms of the reflux and esophagitis occur more common in patients that aged over 55 years old. The occurrence, also the symptoms can occur in young adults, 30s or 40s, and particularly in pregnant women. If the heart pain is not a condition that normally experienced in childhood, so that children with symptoms of heart pain should be therefore referred directly, because this is not a common symptom that occur in children. So presentation of a children with the heart pain, this will indicate direct referral for this child for more investigation. You should know the symptoms that are associated with the heart pain and the other factors. Heart pain is often brought on by bending or lying down. Bending اللي هو الانحناء أو lying down. Also, these symptoms can bending or lying down can brought on the heart pain. It is more likely to occur in those who are overweight and can be aggravated by a recent increase in weight. زيادة الوزن واحدة من ال precipitating factor أو aggravating factors that lead to the heart pain. Sometimes the pain can come on suddenly and severely and even radiate to the back and arms. In this situation, differentiation of the symptoms is difficult, as the pain can mimic the heart attack, angina, myocardial infarction, the attack. Have the same symptoms اللي هو البين radiating to the back and arm. This can be اللي هو cannot be differentiated with the anginal attack with the heart pain. So sometimes patient, so in case of there is a difficulty to differentiate between these symptoms, which mimic the heart attack, Here, the urgent medical referral is essential in affairs that may be a heart attack, because the heart attack is the situation that need an immediate intervention and emergency situation. Sometimes the patient who have been admitted to the hospital apparently suffering a heart attack are found to have esophagitis instead, and will be fortunately for these patients, because esophagitis is a minor condition, while the heart attack is the serious problem that involve hospitalization, admission, and emergency interventions. Difficulty in swallowing, اللي هي dysphagia, must always be regarded as a serious symptom that require referral. If the patient complains that he have a dysphagia, describing that there is a difficulty in swallowing, it is better to refer this patient because may indicate a serious condition. Although dysphagia may be a minor origin, but it's better to be in the safe side. It's better to refer this patient. Regurgitation can be associated with difficulty in swallowing. And regurgitation اللي هي is the action of bringing the swallowed food up again to the mouth is called regurgitation. Regurgitation اللي هي الارتجاع, bringing swallowed food up again on the mouth, can be associated with difficulty in swallowing. And this is a sign and a symptom for referral also. If there is a regurgitation, so it's better to refer the patient. It has been estimated that as many as half of all pregnant women suffer from heart pain. Even 50% of the pregnant women suffer from heart pain, especially if these women are aged over 30 years old, which are more likely to suffer from this problem. The symptoms are caused by an increase in intra-abdominal pressure and incompetence of the lower esophageal sphincter. Even the presence of the heart pain in the pregnancy is due to two causes. The first cause اللي هو الانكريز في الانترا abdominal pressure due to the البريشر بتاع الفيتس, and the second cause اللي هو الانكومبتنس اللي هو النقصان في الفاعلية بتاعت اللور esophageal sphincter that relax during pregnancy. You should know the medication that patient already used or already taken or prescribed medication or OTC medication. Any medication being taken by the patient should be also identified. Some drugs can cause the symptoms of heart pain, so that the heart pain may be drug-induced symptom, such as anticholinergic agents such as the hyoscine, and drugs with anticholinergic action such as the tricyclic antidepressants and phenothiazines and butyrphenols also. Antihistamine also. Calcium channel blockers, caffeine, nitrates, بالذات especially النيفيديبين, regarding النيتريتس, النيفيديبين especially, and acetylcholine, aminophylline, also all of these can aggravate heart pain. Failure to respond to antacid and pain radiating to the arms could mean that the pain is not caused by acid reflux. إذا اديت المريض بعد ما جاء complaining from a heart pain and you give him an suitable O2C medication, after 1 week he came to you and he's still that indicating the pain is still not relieved by this medication, this may indicate the cause is not the acid reflux. although it is still possibility, برغم انه قد يكون في failure في الميديكيشن بس، لكن ما زال هو the pain is caused by acid reflux. But other causes such as the ischemic heart disease and the gallbladder disease must be considered if the pain is not relieved by the use of O2C antacid and H2 antagonist and proton pump inhibitors. drugs. When to refer the patient that complain from heart pain, first, if there is failure to respond to antacid, if the pain radiating to the arms because the possibility of ischemic heart disease, if there is a difficulty in swallowing dysphagia, if there is a regurgitation اللي هو قلنا bringing out or bringing back the swallowed food up to the mouth, if the persisting pain of longer duration, if there is increasing severity of the pain, and if the symptoms occur in the children. So this all of these are all of these should be reversed in all of these situations. The time scale here in our symptom or heart pain, if the symptoms have not responded to treatment after 1 week, the patient should see a doctor. إذا التايم سكيل عندنا regarding الهارت pain اللي هو 1 week. Now we'll talk about the management. The symptoms of the heart pain respond well to treatments that are available as OTC medication. The pharmacist, because we have a number of choices OTC medication, the pharmacist will use their professional judgment to decide whether to offer antacid alginate combination, or H2 antagonist, or proton pump inhibitors such as omeprazole as a first line treatment. You should take your judge according to your professional knowledge to decide which you offer to the patient complaining from the heart pain, because all of these are available as OTC medication to manage the heart pain. Preparations that are high in sodium should be avoided by anyone on a sodium restricted diet, such as those with congestive heart failure or kidney or liver problems. They بيكون عندهم restriction في الصوديوم diet, so that you should check your label and avoid the medications that having sodium high content in these preparations. The antacids can be effective in controlling the symptoms of heart pain and reflux, more so in combination with an alginate. إذا ادينا in combination with alginate، عشان كده الantacid with alginate are very effective in relieving the symptoms of heart pain, and it is available as OTC medication. And this is the alginates. The alginates for a raft. Raft means floating layer, طبقة طافية. Raft that sits on the surface of the stomach contents and prevents reflux. Some alginate-based product containing sodium bicarbonate, which in addition to its antacid action causes the release of the carbon dioxide in the stomach, enabling the raft to float on the top of the stomach contents. If the abbreviation if abbreviation low in sodium is required, the pharmacist can recommend one containing potassium bicarbonate instead of sodium bicarbonate. And this is alginate here. This is alginate of low form raft that floats on the top of the stomach contents, so that prevent a reflux of the gastric contents from the stomach to the esophagus. The second available OTC drugs are اللي هم H2 antagonists such as cimetidine, famotidine, and ranitidine, and all of them considered according to the FDA as OTC medication. Cimetidine, famotidine, and ranitidine have been deregulated from prescription only control for the short-term treatment up to 2 weeks for dyspepsia, hyperacidity, and heart pain. هي في البداية كانت تابعة للprescription only drug, prescription only medicines according to الUK. UK نحن زي ما أخذنا في as we discussed in the first lecture قلنا في UK the drugs are categorized in 3 categories. The first one اللي هي prescription only medicines. prescription only medicine. And the second one is the B اللي هي the pharmacist والpharmacy available products. And the third one اللي هي general sale list is according to UK. إذا السايمتيدين والفاموتيدين والرانيتيدين firstly كانوا هم they are categorized as prescription only medicine, then deregulated اللي هم they shifted from the prescription only control to اللي هو prescription to the اللي هي second category اللي هي for the short term اللي هي up to 2 weeks for treatment of dyspepsia, hyperacidity and heart pain. The 2-week treatment limit is intended to ensure that the patient don't continuously self-medicate for long periods. ونحن هم زي restricted only for 2 weeks عشان ما يتأكدوا إنه المرضى يستخدمون فقط لمدة أسبوعين وما يديه الإحساس إنه هو قاعد يعالج نفسه for long term periods. إذا restriction only for أنت مسموح لك it's allowed to you as the pharmacist to give this patient H2 antagonist only for 2 weeks duration, not longer than that. The H2 antagonists have both a longer duration of action up to 8-9 hours and a longer onset of action than antacids. Where food is known to precipitate symptoms, the H2 antagonist should be taken an hour before the food. The H2 antagonist is better to be given 1 hour before the meal. And usually ranitidine and cimetidine are given twice daily, while famotidine is given once daily. The H2 antagonists are also effective for prophylaxis of nocturnal heart pain. Headache, dizziness, diarrhea, and skin rashes have been reported as adverse effects, but they are not common. The manufacturers of these H2 antagonists state that the patients should not take cimetidine, famotidine, or ranitidine without checking with their doctor if they are taking other prescribed medicines to avoid the drug interaction, and especially with the cimetidine, which is known as enzyme inhibitor that can interact with many types of drugs. Cimetidine is famous with the brand name Tagamet, and ranitidine the famous with Zantac, and famotidine is famous with the brand name Bepsid. The cimetidine can be sold OTC as a maximum dose of 200 milligram and maximum daily dose of up to 800 milligram. The drug binds to microsomal cytochrome B450 in the liver and inhibits the normal operation of the enzyme system, increasing the level of some drugs. So قلنا هو cimetidine is famous with its drug interactions. As a result, cimetidine has a number of significant interactions with other drugs, including cephalin. Cephalin, one of the lower index, the drugs that having a lower index or lower therapeutic index, resulting in a toxic levels of cephalin. Other important concurrent drugs to be avoided is warfarin and phenytoin. Warfarin also is having a lower therapeutic index. Famotidine does not affect the cytochrome B450. Actually, famotidine and ranitidine, both of them are having they haven't an effect on the cytochrome B450 system, and therefore does not cause the same range of interaction as cimetidine. The drug is licensed for OTC use at a maximum dose of 10 milligram and a maximum daily dose of 20 milligram. Famotidine is also available as a tablet in a combination with the antacid magnesium hydroxide and the calcium carbonate. The idea behind this combination is to provide rapid symptoms relief from the antacid لأنه الفاموتيدين عنده lower onset of action لكن عنده longer duration of action, shows that to relieve to have to أو to gain a rapid relief of the symptom we use الانتاسيد لأن عندها rapid onset of action, and while the famotidine will provide with longer duration of action. The ranitidine is licensed for OTC use in a dose of 75 mg with a maximum daily dose of to 300 mg. Ranitidine does not affect the cytochrome B450 as cimetidine. Now we have proton pump inhibitors such as omeprazole was recently deregulated to be medicine. برضه this is according to the UK. برضه هو كان firstly هو كان categorized as BOM اللي هو prescription only medicine to be medicine, و be medicine قلنا احنا have the pharmacist have a rule to give this without the need of prescription, يعني كأنها هي زيها وزي over the counter medication. For the relief of heart pain symptoms associated with the reflux in adults. Proton pump inhibitors, including omeprazole, are generally accepted as being amongst the most effective medicine for the relief of the heart pain. It may, however, take a day or so for them to start being fully effective. إذن هي اللي هو عندها slower onset of action لكن عندها long duration of action لأن البروتون بامب inhibitors هي irreversibly inhibit البروتون بامب اللي هي الهيدروجين بوتاسيوم ATPase that occur في الgastric parietal cells. During this period, a patient with ongoing symptoms may need to take concomitant antacid. يعني عشان كده ممكن ندي antacid concomitant antacid to relieve rapid relief to provide a rapid relief of the symptoms, and the long اللي هو relief will be provided by the proton pump inhibitor. Patients taking omeprazole should be advised not to take H2 antagonist at the same time. The tablets should be swallowed whole with plenty of liquid prior to a meal. It is important that the tablets should not be crushed or chewed. لأن دائما البروتون بامب انهبيترز هي بتكون مصنعة في شكل بتاع انتريكوتد tablets because proton pump inhibitors can be affected by the acidic pH of the stomach, so that we will quote او بتلقى دايما في شكل بتاع الفورميوليشن بتاعها في شكل بتاع انتريكوتد tablet. If no relief is obtained within 2 weeks, the patient should be referred to the doctor. Omeprazole should not be taken during pregnancy or whilst breastfeeding. Treatment with OTC omeprazole may cause a false negative result in the breast test for Helicobacter pylori. والبريس تيست هو واحد من التيست اللي بنعمل به ايدنتيفيكيشن او نثبت به الايدنتيفيكيشن او الاوكيرنس بتاع ال H2 بايلوري في الاستمك اللي هو بيدوا اورالي او اورالي تابلت او بيلز اللي هي كان يحصل لها ديجنريشن في الاستمك تتكسر وفي الاستمك وبالتاثير بتاع الاتش بايلوري اذا موجوده she will lead to اللي هو الفريز اللي هو الموبيلايزيشن بتاع الكربون دايوكسيد او which can be detected في البريس. ده تيست بنقيس بيه البريزنس بتاع الاتش بايلوري. فاذا المريض بياخد في بروتون بامب انهبيترز وعملنا له التست ده قد يديني اللي هو فولس نيجاتيف، يعني هي تكون اصلا موجوده لكن ما حيصير لي لانه ما حيحصل لي ديتكشن للكربون دايوكسيد في البريس نتيجه لانه الاتش بايلوري inhibited by البروتون بامب inhibitors, so this will result in a false negative result of the test. Now we'll have practical points for the patients suffering or complaining heart pain as a symptom. If the patient is overweight, weight reduction should be advised. Weight loss reduces the symptoms of the heart pain. This is اللي هو one of the advice that can be given for the patient if they are overweighted. Small meals eaten frequently are better than large meals in which a reduced or reducing of the amount of the food in the stomach reduces the gastric distension, because a large meal can result in gastric distension, which helps to prevent الريفلكس. اذا by giving small meals يمكن ياخدوها frequency، يعني بدل ما ياخد 3 وجبات في اليوم 4 5 وجبات مش مشكله، لكن تكون small meals بدل اللارج ميل، لان اللارج ميل هتعمل لي جاستريك ديستنشن، والجاستريك ديستنشن ده كان اللي هو اجريفيت او كان افلكس الجاستريك كونتنت to the stomach to the esophagus. The evening meals is best taken several hours before going to bed. برضه واحدة من البراكتيكال بوينتس اللي should be advised to the patients suffering أو complaining from a heartburn إنه to have ال evening meals بتاعتهم several hours before going to bed. Also, a tight constricting clothing, especially waist pants and belts, can be can be an aggravating factor and should be avoided. Smoking, alcohol, caffeine, and chocolate have a direct effect by making the esophageal sphincter less competent by reducing its pressure, and therefore contribute to the symptoms of heartburn. Now we have a study case. We have Mrs. Army Beston is a woman aged about 50 years of age who wants some advice about a stomach problem. On questioning, you find out that sometimes she gets a burning sensation just above the breastbone, and that she feels the burning in her throat, often with a bitter taste, as if some foods has been brought back up. The discomfort is worse when when in bed at night and when bending over whilst gardening. أثناء ما هي في الحديقة وبتعمل gardening bending البين بيكون بيحصل له worseness. She has been having the problem for 1 to 2 weeks and has not yet tried to treat it. Mrs. Beston is not taking any medicines from the doctor. To your experienced eye, this lady is at least stone اللي هو overweight. حسب ما نظرتك انت شفت عليها هي قيمتها ان هي overweighted. You ask Mrs. Beston if the symptoms are worse at any particular time, and she says that worse shortly after going to bed at night. The questions: what is your treatment recommendation and what is your practical advice? Here is the answer. This woman, Mrs. Weston, has many of the classical symptoms of heartburn. Head pain at the retrosternal region and reflux. The problem is worse at night after going bed, and this is a common اللي هو sign بتاعت heartburn. It would be reasonable to advise recommendation بتاعتك. It would be reasonable to advise the use of alginate antacid products about 1 hour after meals and before going to bed, or الخيار الثاني H2 antagonist, and the third choice also ممكن proton pump inhibitor. Up to you. All of them are OTC medication. The practical advice would include the following. Mrs. Beston symptoms would be improved if she lost weight, because you see her, Mrs. Beston are overweighted. You can advise her to reduce the weight, and reduction of the weight will reduce the symptoms, heart symptoms. Mrs. Beston's could also try raising the head of the bed or using extra pillows at bedtime to avoid the nocturnal symptoms of the heart pain. Wearing loose fitting clothes also اللي هو can reduce the symptoms. Cutting down the use of tea, coffee, and if she smokes to cessate or اللي هو no smoking أو to stop smoking. Also, you can tell her to avoid large meals and instead small meals, even frequently, are better. That is all regarding these symptoms, and thank you. Assalamu alaikum wa rahmatullahi wa barakatuh.